Bismillahirrahmanirrahim. Assalamualaikum. Myself Isha Tariq Bhatti, MPhil Pharmaceutics from Punjab University, and I'm working as a lecturer in Faculty of Pharmacy, Hajwari University. So this is my fourth lecture of Biopharmaceutics and Pharmacokinetics, and the topic of today's discussion is elimination of drugs through other organs. So first of all, we will see what are the learning outcomes of this lecture. So, dear students, by the end of this lecture, you will be able to understand drug elimination, excretion of drugs, type of excretion, non-renal drug excretion, biliary excretion, pulmonary excretion, salivary excretion, mammary excretion, and skin excretion. So, first of all, we will see what is drug elimination. So, termination of drug effect is by the process of drug elimination, which involve mainly two processes. So the drug which will enter into the body get eliminated from the body, or you can say that the effects of the drug are terminated off by the process of elimination. And elimination is the combination of two processes. And what are these processes? We will look ahead. It is first of all metabolism, that is predominantly performed in the liver or in the kidney, but very minutely. You can say the major metabolism process is takes place in the liver, as major of the you can say metabolizing enzymes that are cytochrome P450 system is mainly located into the liver. So liver is the main metabolizing organ. Next process is excretion. Excretion of unchanged drug or its metabolite predominantly by kidney. So the unchanged drug or its metabolites are predominantly excreted by kidney. Excretion also takes place in gut, skin, lungs, sweat glands, breast, and salivary glands. So there are other routes of elimination. You can say that non-renal route of drug excretion, that are gut, skin, lungs, sweat gland, breast feeding, or you can say that mammary excretion or salivary glands or salivary excretion. In addition, there is a third process of termination of drug action, that is process of redistribution of drug. So there is another process that is called redistribution of drug. Say for example, we have studied biliary excretion. So in case of biliary excretion, the drug that is the metabolized drug, or you can say that conjugated drug, come from bile duct into the gut, and from there you can say that it is again you can say their metabolizing enzyme in the GIT break down or hydrolyze this conjugate and a free drug is available, and which is then again reabsorbed by the liver, and the metabolizing process is again you can say metabolizing process again takes place. So this is the process by which redistribution of drugs takes place. This is an example which I have given you. So next comes the onset of pharmacological response depend on number one, drug absorption, and number two, drug distribution. So for the onset of drug response, two processes are very much necessary. First one is absorption, and second one is distribution. So once the drug enters into the body, it gets absorbed and then distributed into the organ, and then it performs its action. This is not that once we intake the drug and once it inside the body it starts its action. No. What happened? First of all, drug get absorbed, then get distributed, and then it start to perform its pharmacological response. Then the duration and intensity of action depend upon two processes. First of all, tissue redistribution of drug, and the second one is the rate of elimination. So these are the processes on which the duration and intensity of action depend. So how long the drug remain redistributed to the tissues, and what is the rate of elimination of drug. So these are the parameters on which the response and duration or intensity of drug action is dependent on. Next is excretion of drug. So what is excretion? Excretion is defined as the process whereby the drug and or their metabolites are irreversibly transferred from internal to external environment. So excretion is the process by which metabolites or by which uh, whereby the drug and or their metabolite irreversibly transferred. So what happened in excretion basically? The drug once it metabolized, the metabolites where it go? Metabolized, the metabolites um, they get, you can say, eliminated from the body, or you can say excreted from the internal body to the external environment. And there are many routes of elimination through which the drug get excreted from the body. So what are these routes? We'll see. There are two types of excretion. First of all is renal excretion, and the second one is non-renal excretion. So under non-renal drug excretion, there are other routes of excretion, which are lungs, biliary system, intestine, salivary glands, sweat glands, and mammary glands. These are the other, you can say, non-renal route of drug excretion. So this is a diagram which shows that drug is metabolized by cytochrome P450, and that is a system. Cytochrome P450 is an enzymatic system which break down the drug into its metabolites, and it is mainly located into the liver. Or drug get conjugated by glucuronide, or you can say um, other moieties to form conjugate, and a stable adduct is formed. So the drug metabolites, if they are polar one, they get excreted through renal elimination. But there are some cases in which the drug metabolite get conjugated with the conjugating moiety, such as, say for example, glucuronidation, undergo glucuronidation, and glucuronide conjugate is formed, which is a stable adduct, which then eliminated from the renal elimination through elimination route. Or you can say that if the drug is metabolized or gone into the liver, then from there, if the elimination route is biliary excretion route, what happen? Drug from the liver comes back into the gut, from where the drug is excreted through biliary elimination into the stool, or you can say in the feces. It is usually the non-polar drug which get excreted through this route of administration, as the molecule is bigger. And the renal route, from renal route, glomerular filtration cannot happen of such molecules. So next is non-renal routes of drug administration. There are pulmonary, you can say that, then through biliary route of excretion, or you can say the salivary route of excretion. These are some figures which are mentioned on that slide, which I have explained to you. Next comes drug. Drug and their metabolite may also be excreted by routes other than renal route, called as extrarenal or non-renal route of drug excretion. So what are these route of drug excretion? As I told you earlier, these are biliary excretion, pulmonary excretion, then comes salivary excretion, then mammary excretion, then scaenodermal excretion, then gastrointestinal excretion. So now one by one we will discuss them. First of all, biliary excretion or enterohepatic cycling. So what happened in biliary system? Biliary system is the one which is located with, which is associated with the liver. Gallbladder is found in the along with the liver, where the bile stored, and from this bile duct, the you can say that from this bile duct, the bile comes into the gut, um, enter into the duodenum, and you can say the drugs which are eliminated through biliary route of excretion, they comes along with this duct into the gut, and from there it get eliminated from the body in the form of feces or fecal material. Then comes biliary excretion. Bile juice is secreted by hepatic cells of the liver. So the flow is steady, 0.1 to 1 ml per minute, and 90% of the bile acid is reabsorbed from the intestine and transported back to the liver for re-secretion. As I have told you earlier, that in case of biliary excretion, what happened once the drug is excreted from the bile, it comes into the gut, from where if it is glucuronide conjugate or you can say other conjugate, they get hydrolyzed by you can say enzymes, that is cytochrome P450 enzymes, or you can say that mixed function oxidase enzyme into its metabolite, and the free drug is again available into the body, which get which get into the you can say that the free drug is again taken up by the liver, from where it is again metabolized and the cycle is repeated. So greater the polarity, better the excretion, better the drug will be excreted from the body if it is more polar. Then comes the metabolites are more excreted in bile than parent drugs due to increased polarity. If the metabolites are, as you know, that the process of metabolism is to detoxify the drug or to convert the active drug or the parent drug into the more solubilized form. So what happens when the drug is converted into more solubilized form? It gets polarized. So the polar drugs, they are, or you can say that the polar metabolites are more excreted in bile than the parent drug. This is the process by which this excretion takes place. So this biliary excretion is an active process, capacity limited and saturable. And the examples of drugs which undergo this route of excretion are quinine, colchicine, vinblastine, tuberculin, vincoronium, then corticosteroids, erythromycin, chlorpromazines. These undergo biliary route of excretion. Then comes enterohepatic circulation, or you can say that it is enterohepatic cycling. So this is the liver, this is the bile duct, and from this duct, the bile comes into the intestine, and from this intestine, it is again absorbed through blood into the through the portal vein back into the liver, and then this cycle will continue. So what happened? Um, we will study the phenomena of drug cycling between the intestine of the intestine and the liver. For example, the drugs which undergo this type of excretion are, or this type of circulation are, cardiac glycoside, rifampicin, cardiac glycoside, for example, digoxin, digitoxin, they comes under the cardiac glycosides, and then rifampicin, chlorpromazine, and indomethacin, they undergo biliary excretion. And the drugs which have high, you can say, half-life of which are higher, or you can say longer half-life. For example, oral contraceptives and dichlor, diphenyl, trichloroethane undergo this type of excretion. Then comes prolongation of drug action. How the drug action will be prolonged. Say for example, we have taken an example of rifampicin here. What happened to rifampicin? This drug is deacylated by liver, and both the free drugs and deacylated metabolites are excreted through the bile into the gut, from where rifampicin is reabsorbed, while deacylated metabolite is excreted through feces. So what happened? um, in this route, or with this drug, is that the drug get deacylated by the liver enzymes, and the drug which is deacylated and also the free drug, they both are excreted through bile into the duct. When it comes into the gut, the enzymes which are present in the gut, what happened to them, or what is the next process which happens with rifampicin? Rifampicin, which is available in the free form, is get reabsorbed from the you can say gut back into the liver, and the deacylated moiety, or deacylated metabolites, which are you can say convert in which the active drug is converted into deacylated metabolites, are excreted through feces or in the form of fecal material. Then this drug acting as a small circulating reservoir, in turn prolongation of drug action. So this drug acting as a small circulating reservoir. This drug rifampicin act as a small circulating reservoir, which in turn which keep on you can say circulating between liver and the gut, and in this way the drug action is prolonged. Then comes certain drug metabolites, particularly glucuronides, are excreted through the bile and delivered to the intestine, where these metabolites are reconjugated or hydrolyzed, releasing the parent active drug again. The free drug is then reabsorbed and the cycle is repeated. Enterohepatic circulation. So as I told you earlier, that the glucuronide moiety, or you can say the metabolites which are conjugated with glucuronides, they are excreted through bile into the intestine, from where the enzymes which are present in the gut, they hydrolyze these conjugated metabolites, and the active drug is again, or you can say the free drug is again available into the intestine, from where it get from where through portal vein, hepatic portal vein, it gets reabsorbed into the liver and the cycle is repeated, which is known as enterohepatic circulation. And the example of drugs which undergo this type of circulation are thyroxine, morphine, chloramphenicol, phenolphthalein, ethinyl, estradiol, indomethacin, particularly secreted as glucuronide. And this is the example. So here is a figure is shown, which represent how the drugs get eliminated, or you can say are recirculated into the body. Drug in blood, first of all, drug that is absorbed and then distributed come into the blood, from where it is metabolized to conjugate in the liver and conjugate in the bile, then conjugate in intestine, then drug in intestine, and then it is again reabsorbed, or you can say absorbed by back into blood, through which it again goes into the liver and the cycle is repeated again and again. Some of the drug that is in the blood, it get eliminated through renal excretion, and some of the drug which is in the, you can say, metabolite form, get excreted from the bile into the gut, from the gut, which comes through bile into the gut, in and ultimately it is excreted through the feces, or you can say fecal material. Then comes factors which influence the secretion of bile. Physiochemical properties of the drug, for example, molecular, first of all is molecular weight, how it influenced. Molecular weight greater than 300 Dalton, what happened, it excreted the drug in the urine, or less than 5% in the bile. And the drugs which are less than 300, they undergo this type of excretion. Then the drugs which are greater than 500 Dalton, they are excreted into the bile, and less than 5% in the urine. And drugs between 300 to 500, they both are excreted in the urine or bile. They get excreted through both of these routes. Then comes the polarity. Polarity, as I told you earlier, polarity is directly proportional to excretion. So there's the metabolites better excreted in bile than the parent drug. So the metabolite, as they are more polar, they are better excreted into the bile, and then from the parent drug molecule. Then comes nature of biotransformation process. So for example, phase 2 reactions, first of all is glucuronidation, that is the conjugation reaction, and the drugs which undergo this type of conjugation are morphine, chloramphenicol, indomethacin, and silbestrol. And then glutathione. Glutathione is another, you can say, conjugating molecule which form conjugate with the drugs and help in elimination of the drug or biotransformation of the drug. Then comes other factors such as sex and species difference. So the elimination of drug, or you can say the secretion of bile, differ in different species or different in different sex. Say for example, it is different in male and female. Then comes protein drug binding. Protein drug binding also play an important role, as the drug which is binded to protein, it is not available for liver to metabolize it. So once it is available to the liver, it get metabolized and then excreted from the from the body. So as longer as the drug is bound to protein, it is available in the body. And it is available in the form of, you can say, protein bound drug. Then comes disease state. Disease state affect the bile secretion, as you know that in case of hepatic compromised patients, what happened, they need drug dosage adjustment. So if we don't do the dose adjustment, what happen, the greater amount of drug will be delivered to the liver, as the liver function is already compromised. So what happened, the compromised function of the liver, they will not able to you can say metabolize the drug, and as the drug is not get metabolized, it will starting build up the drug into the body, which may cause toxicity reactions. And also drug interaction, it can also influence the rate of elimination of bile, or you can say bile excretion rate. So drug interaction is an important. You can say that some drugs are inducer and some are inhibitors of cytochrome P450. So the drugs which induce the enzyme, they will accelerate the metabolism of the drug, and the drugs which are inhibitors of cytochrome P450, what they will do, they will hinder the metabolism process and may develop toxicity reaction. So it is very important to determine what is the whether or not drug have any interaction with the drug which the patient is taking simultaneously with that drug. Then comes pulmonary excretion. What happened in pulmonary excretion? The volatile, or you can say gaseous substances. So gaseous and volatile substances such as general anesthetics, for example, halothane, are absorbed through lungs by simple diffusion. And next is pulmonary blood flow, rate of respiration, and solubility of substances affect pulmonary excretion. So these are the factors on which the pulmonary excretion depended upon. That is pulmonary blood flow, rate of respiration, and solubility of substances. They affect the pulmonary excretion. Then comes intact gaseous drugs are excreted but not metabolites. So intact drugs are excreted through this route, not the metabolites. Alcohol, which has high solubility in blood and tissue, are excreted slowly by the lungs. There are a few examples, that is general anesthesia, that is halothane, nitrous oxide, etc. Alcohol excreted slowly through lungs, and paraldehydes up to 30% dose is excreted by the lungs, and the rest by the liver. So in this case, as the volatile drugs are there, what happened to them? They get excreted through the intact drugs will be excreted by the lungs. And you can say that if the drug is or the alcohol is have high solubility in blood and tissues, and it is excreted slowly by the lungs. And then comes general anesthetics. I have told you about it. And then comes next salivary excretion. What happened to the drugs which undergo salivary excretion? The pH of saliva varies from 5.8 to 8.4. Unionized liver-soluble drugs are excreted passively through this process. The bitter aftertaste in the mouth of the patient is the indication of drug excreted. The bitter aftertaste which we experience after taking some drugs is due to the drug excretion that is happening in the saliva. Some basic drugs inhibit saliva secretions and are responsible for mouth dryness. The drugs which you can say inhibit saliva secretion, they will dry your mouth more frequently. Then the excretion through salivary route is dependent on pH partition hypothesis. That is, the drug is distributed, how the drug is distributed between the two medias. And basic drugs secreted more than acidic drugs into the salivary secretion. Then comes, then we will see a few examples of the drugs which are excreted through this route, that are clonidine, lithium, metronidazole, then penicillin, phenytoin, sulfonamide, salicylate, tetracycline, then pyrazinamide, then ethosuxanate, suxamide, and then digoxin. Then comes estimation of blood levels of drugs like caffeine, theophylline, phenytoin, carbamazepine. Since the saliva to plasma ratio is fairly constant, as this ratio is constant, so these drugs, the estimation of the blood level is quite efficient, or you can say you can determine them easily. Then comes drug excreted in saliva can undergo cycling in a fashion similar to enterohepatic cycling, for example, sulfonamide, antibiotics, and cholinidine. This is the cycle which is shown here, that is oral administration, then through glands, drug comes into the GIT and then into the fecal excretion. This is, you can say, a side mechanism which is shown. Drug administration after it is available in the salivary solution, or you can say saliva, then it goes into the blood, and during this the drug get distributed and eliminated, and this process keep on repeating. Or the drug which is excretion, or you can say that the drug which is meant to be excreted is excreted through fecal excretion. Then comes next, that is mammary excretion. So what happened in this case? Weakly basic drugs concentrate more in milk. So the example of the drug which excreted through this route of elimination is chlorphenicol, tetracycline, or glutamine, morphine, metronidazole, carbimazole, bromocriptine, diazepam, estrogen, progesterone, oral contraceptives, antihistaminic drugs, alkaloids, which are purgative. And here it is shown that breast milk pH is 6.6 and in plasma 7.4. So weak basic drugs, ionized to unionized drugs, ionized drug from basic, you can say that ionized drug from breast milk come into the plasma in the form of non-ionized drug, or it is a reversible reaction. And weakly acidic drugs which are non-ionized form, they can go into the plasma in the form of weak acid ionizable form of drug. Then there are some examples of drug and their effect. Example of drug which are excreted in the mammary glands, or you can say excreted in the from the milk, in the form of milk or from the milk. And what are their effects? Chlorphenicol, it causes bone marrow depression. Diazepam, accumulation and sedation. Heroin, prolongation of neonatal dependence. Then methadone, a possible withdrawal symptoms if breastfeeding is stopped suddenly. Then propyl, thiouracil, suppression of thyroid function. Then tetracycline, permanent staining on the teeth. Sulfonamide, carnicetrus. Then penicillin, allergy. Ampicillin, it causes diarrhea. Then dapsone, it causes hemolytic anemia. Phenindone, it causes bleeding. Phenobarbital, it causes drowsiness. Phenytoin, it causes methemoglobinemia. Then theophylline, it causes restlessness. And then comes sweat, or you can say the skin route of elimination or skin excretion. What happened depend on pH partition hypothesis, and keratin precursor cells excrete rhizopulpin, hair follicles, arsenic, mercury, and iodide. Then sweat, it excrete urea derivatives, amine, heavy metal, benzoic acids, salicylic acid, and alcohol. And sweat patches, they excrete amphetamine, ethanol, heroin, cannabis, and nicotine drug. Then comes fecal elimination. And what happened in this case? Water soluble and ionized form of weakly acidic and weakly basic drugs is excreted in the GIT. Example of drug is nicotine, quinine, magnesium sulfate, streptomycin, neomycin, bacteriocin, cholestyramine, erythropoietin, chlorpromazine, and corticosteroids. They are excreted through gut. I have told you regarding their mechanism. And the summary of this lecture is we have studied drug elimination, excretion of drugs, type of excretion, non-renal drug excretion, biliary excretion, pulmonary excretion, salivary excretion, mammary excretion, and skin excretion. So thank you so much. Thank you for listening. So students, if you have any question pertaining to this lecture, you can ask me on Google Classroom discussion board, and the class code for the Google Classroom is mentioned on the last slide. So thank you so much.